Do you think that patients should see their own medical records? Do they belong to the doctors? Do the patients have rights?
Well, it's a good question. I think that the patients do have the right to see their medical records. They should know what their doctor is thinking. Their doctor should find a way to explain to them what's going on so that they understand what's happening.
Well, there's more to medical records than just the doctor's notes. I mean, when a patient's in the hospital, the nurses and the therapists and everybody writes in their chart. And I would think that if you thought that the patient was going to be reading it, your notes might be a little bit different.
Well, maybe they should be. I mean, because what we've got is a relationship here that's important between the patient and all of the people that are involved in care. And the hospital might be slightly different because when people are sick, they can't interpret things right. Their thinking may be fuzzy. There'll be lots of reasons not to.
One of the things that I'm thinking about is like if they have something personal to share with you, and you think that that information might be helpful for the doctor to know, so you put it in the chart. But if you knew that the patient was going to read it and saw that you put this personal information, you might not write it. Or what if the doctor ordered a placebo for the patient? Or there was some other personal thing, or the patient had a mental problem, or they had substance abuse.
Well, see, it's not all cut and dried. There are lots of cases where you're not quite sure what to do.
Or even if a person had cancer and the doctor hadn't had a chance to really talk to the patient about it yet and wanted to have the time to sit and be with them.
Well, see, you're picking all the cases where it's really controversial. But in general, doctors and patients should have relationships that are very personal and that are very open and honest. We shouldn't have secrets from our patients. If someone's got cancer, I'll find a way to tell them.
Yeah, but they might get the chart. If they have a right to the chart, they might see the information before you have a chance to talk to them.
Well, they may not either. It depends. We send out, if they're asking for my records from my office, I'm probably going to delay sending that chart because I know better than to do that. So it's not all like it's a negative thing and patients shouldn't have the charts.
But your nurse might not realize that, or you might be in a hurry.
Well, you're being tough. You're being difficult.
Well, it's good to look at both sides.
Occasionally you're going to have problems like that, but in general, a patient deserves to know what's in their chart. I don't put things in my chart very often that I don't want my patients to see, because they will get access to the charts because I provide that access for them.
Well, you do more than provide that access for them, because when your patients come to see you, you play a CD during the office visit and you give them the CD to take home. So everything's there for them to go over. But that's a little bit different than looking at the medical records.
Well, it's about as good as you can get. It's to give them a CD.
But I think people have a right to know what their lab work is. And
they have a right to know everything about them, and the judgment of the doctor as to what they should and shouldn't know should be considered. And there are times that I agree with you, Vicki, that there are going to be exceptions to rules. But in general, we have to have a general policy. I think a patient deserves to have their medical records. Now, a lot of people agree with you. I mean, out of 170 doctors that were in this study that was published in the Annals of Internal Medicine on 37,000 patients, it was called Open Notes Program, 63 doctors out of the 170 refused to participate. But 4 out of 5 patients, which means 1 out of 5, thought that medical records were something they should have. I mean, 80% thought they should have access to it. The other 20% didn't care. And there are times when you wouldn't give it to a patient. I mean, if you've got a patient who won't take responsibility, that's not very capable of assuming responsibility for what's happening, and doesn't really understand a lot of what's happening with their health care, you may want to not have that happen.
Yeah, but if it becomes a legal thing, you might not have that choice.
Well, see, you're the devil's advocate here, and that's good. And there are times when you just have problems that you can't solve, and you have to accept that as part of the deal. I think that a lot of the time there are going to be problems with that, but you're still looking at what should the doctor-patient relationship be. It should be open. It should be honest. It should be one where it's personal. There should be a collaboration between yourself and your patient.
Well, one thing that will happen, if this does happen, is that the patients will have a lot more questions.
Excellent.
And this is good, except for with HMO medicine, there's not enough time already.
It's bad for them because they're more profit-oriented than they are service-oriented. But I think that letting patients participate in their own care, which I do with my patients, sometimes means that they're going to email me once a day for 3 or 4 days or a week or 2, depending on what the situation is, because they're all over the internet trying to read stuff about their healthcare issue because we haven't resolved it.
Well, you see, that's okay with your patients because you don't charge them for emailing you, but a lot of doctors and a lot of plans charge patients to email them.
Yeah, well, that's a personal choice, and I think that it's fair enough to bill for that. But for me, it's a more personal thing, and I want people to know that I'm available and that I care about them. See, 2 things are really important for a doctor. One is to listen, I mean really listen, and the other is to care about them, which means that you're willing to go beyond what you might do if you didn't listen and care. And HMO medicine, which is much more impersonal than my practice is, would have a real problem with that. And so you're not going to see the kinds of relationships that you see in my office as you will see in an HMO's office. I understand that.
But you know, too, then on the other hand, the patient is hiring the doctor. The doctor's working for the patient.
That's right.
So the notes really should be the patient's. It's just that I think that if the patient's going to be seeing all these notes, that probably they're not going to be, there won't be as much written in the notes as there might have been otherwise.
Well, I think we should be responsible as note writers, as doctors, to put in the chart what should be in the chart. And there will be times, if you know the patient's going to have access to it, that you're not going to put some things down there because it would be something that would upset the patient to see.
And then on the other hand, the doctor might want to remember these facts and remember these things on the side. So maybe you have a separate chart or you have a journal on all your patients?
You can't do that. You have to hope that you're not seeing too many patients to remember. And if you see a few patients a day and you work through their tough problems, you'll remember, if you care, what's going on most of the time.
Yeah, but sometimes you see so many people, it might be difficult to remember. I remember when you don't like me to
Well,
disagree.
you're a pistol today. You're just going to really go after that.
I remember
other
one time
side.
I was working for a doctor and I pulled the wrong chart because somebody came in at the last minute and they happened to have the same last name as another one of his patients.
Yeah.
And I gave him the wrong chart, and oh my goodness, was he mad, because he really prided himself in doing what you're talking about, sitting there and chewing the fat and being a buddy to his patients and everything. And he sat there doing that, thinking that it was the other patient, and he was really embarrassed.
Well, it's
I almost
understandable.
lost my job on giving him that chart.
Well, if you've got a few thousand patients, it's hard to keep a lot of it straight. And if you don't see them all the time, then it becomes even more difficult. But let's get to the bottom line here of, should a patient see a medical record? You have to use your judgment. And there are going to be problems, obviously, that you can't resolve, that are going to be challenges. But in general, if we have a policy where we include the patient in as much as we can, they'll come up with things because they're doing their own research as well. It sometimes will surprise you. I had a patient just in the last week who had been doing a lot of their own work, had their own ideas, and a lot of them different than mine, come up with an answer that added a lot to try and add to what we could do to manage your problem. So I think that there are challenges here, but in general, let's go on ahead and include the patients in a more personal relationship. Let's give them their records if they want them. Let's invite them to participate in helping us as we do our workups and make diagnoses and find treatment programs.